Hello guys, my name is Ashley Lindo. I go to Mount Pleasant and I'm a senior.
I'm Grace Weber. I'm also a senior and I go to Beale City.
Okay, so today our project is going to be on ALS.
Also known as Lou Gehrig's disease or amyotrophic lateral sclerosis. So to start us off, what is ALS? It's a progressive disease that causes muscle and nerve degeneration of the brain neurons and the spinal cord, which then affects the voluntary movement of muscles. It's a hereditary disease that has a 50% chance of being passed down from parent to child.
Okay, and then down here we have an image that shows how ALS works. We have a normal nerve cell sending off a message to a muscle that contracts normally, whereas with this one you have a damaged nerve cell which sends a message but does not properly contract the muscle, which is how ALS works.
Yes.
Okay, so we also have the etiology or the cause of ALS. ALS happens to be a genetic disease. You get it from birth from either your mom or dad, and you have the chance of passing it on to your children. But there are some rapid onsets that might cause ALS to progress faster, such as smoking, work hazards, or chemical reactions.
So signs and symptoms of ALS can vary for each person. Some common signs to look for are difficulty with activities of daily living, falling or tripping quite frequently, weakness in your extremities like your arms and your legs, difficulty breathing, speaking, eating, or dementia.
Okay. How is ALS diagnosed? So there is no set in stone way of how to diagnose ALS. Many doctors struggle with trying to diagnose it, but basically they run a series of tests to rule out other diseases that mimic ALS. So one of the most popular exams to diagnose this is the electromyogram, which is one of the most important. They attach patches to your skin to check for any muscle weakness or damage and any abnormalities. Secondly, we got the nerve conduction study. Only 10% of ALS patients have a problem with their nerve conductivity, but it's really helpful for ruling out other neurological diseases that mimic ALS.
So they also use MRIs or magnetic resonance imaging, but MRIs do not diagnose ALS, they just help rule out other diseases. They also use muscle biopsies, which take pieces of your tissue and then they stain them for observation, and then they look for any noticeable abnormalities within the tissue. They also use blood and urine tests or spinal taps, and they can be used to determine what gene mutation of ALS that the patient has.
All right, then right here we have an image of how a nerve conduction study works. Basically, they attach a little machine that fires electricity through your neurons to see if they fire properly and you have muscle contraction. But so treatments for ALS, it is not curable. There is no way to reverse or halt the symptoms or progression of ALS, but there are ways for people who have ALS to cope with it, such as therapies like physical, occupational, speech, and breathing therapy.
So there's also certain medicines that they use to help cope with the disease. They use a medicine called riluzole, which is taken orally, and it's been shown to increase the life expectancy by 3 to 6 months. They also use a medicine called edaravone, and it's given by an IV or an intravenous infusion, which reduces the rate in which daily functions decrease.
Okay, and then down here also we have a graph which shows that ever since 1988 we have a exponential growth of deaths with patients who have ALS, meaning there is no technological advances that we've seen in medicine to help cure or treat ALS.
So the prognosis, it's a fatal condition, so if you have the disease, you're going to die within a certain amount of time. 50% of patients die within 3 years of being diagnosed. 20% survive 5 to 10 years after being diagnosed, but many patients develop respiratory issues and pulmonary conditions, which then result in death. So right here we have an image of Stephen Hawking, who's probably the most well-known ALS patient. He was a super famous physicist and mathematician, and he made lots of advancements in the science world.
And then last we have an image up here which just further explains how the neurons affect the muscle contraction. In ALS, you get improper, imbalance, messages sent by your neurons where your muscles don't contract, and that's where the muscle weakness and abnormalities come from.
So that's ALS.
ALS. Thank you guys.